Adverse drug events, which are defined as injury due to a medication, are very common. They affect approximately 10% of patients during hospitalization and 15% of patients during the first few weeks after hospital discharge. Errors in the medication history that healthcare providers take from patients are an important contributor to adverse drug events. These errors account for up to 75% of all potentially harmful medication discrepancies in admission and discharge orders. Errors in the history can lead to patients receiving the wrong medications. Taking a good medication history is therefore not just a regulatory requirement. It's important for improving medication safety during transitions of care. The goal of a good medication history is to obtain complete information on the patient's regimen, including the name of each medication, the formulation, the dosage, route, and frequency. You should also distinguish between what patients are supposed to be on versus what they actually take. A good medication history also ideally includes other aspects of the medication regimen, such as indications for each drug. It is helpful to know about any recent changes in the regimen, including drugs that were recently stopped, started, or prescribed for a short course, such as antibiotics. Over-the-counter drugs, samples, vitamins, herbals, and other products should be included. Ask when the patient last took each medication. It's also important to note the patient's allergies and the associated reactions, as well as their various prescribers and pharmacies. Taking a good medication history is not easy. Many healthcare professionals have not received training in how to take a good medication history. Compounding this, patients may not be familiar with their medications and may not have a medication list available. Also, available sources of information, for example from the ambulatory medical record, may be incomplete, out of date, or conflicting. As a result, errors in the medication history are common. Some examples include omitting a medication, thinking that a patient is on a medication that she is not, or documenting the wrong dosage or frequency. The time it takes to obtain a good medication history can be a barrier as well. But with proper training and practice, providers can get both better and faster in taking an accurate history. Here are some tips on how to take the best possible medication history. Try to use at least 2 sources of information. These may include interviewing the patient, reviewing the patient's written medication list, or obtaining information from family members or caregivers. Trying to verify information through the patient's medication bottles, a medication list in the medical record, or the pharmacy where the patient fills prescriptions is also helpful. As you obtain information from different sources, it's important to explore and clarify any discrepancies that you find. Using an available medication list, for example from the outpatient medical record or a recent hospital discharge summary, can save time and reduce errors in the medication history. However, medication lists often are not current or accurate. The list may be incomplete or contain errors. It is important to review and verify the list with the patient. But don't just read the list to the patient and ask if it is correct. Instead, you should start by asking the patient to tell you what they are taking, or at least how much and how often they take each medicine on the list. This increases your chances of finding inaccuracies in the list you have and also lets you assess the patient's understanding of their medication regimen. Then use the list to explore discrepancies and confirm information. Finally, you should probe to identify additional medications or products which may be absent from the list. Here are some suggested questions to help you obtain an accurate medication history, whether or not you start with an available medication list. Begin with a simple, open-ended question like, "What medicines do you take?" Then ask about scheduled and PRN medications. You can probe PRN drugs by giving common symptoms that may prompt medication use, such as headaches, allergies, or insomnia. Then fill in the gaps. For each medication, elicit the dose and time of day the patient takes it, if this information has not already been provided. When appropriate, ask about formulations, such as extended-release forms of diabetes and blood pressure agents, and route of administration. Asking about the purpose of each medication provides information about patient understanding and may also lead to additional prompts. For example, asking if the patient takes anything else for that condition. Asking about medications for specific conditions that the patient has, based on the patient's problem list, also helps complete the medication list. Ask about medications that are easy to forget, including those that are not taken orally, are taken at night, or are used at longer intervals, such as weekly or monthly. Ask about non-prescription products as well, including vitamins. Assess when the patient last took a dose of certain medications, particularly those that have a narrow therapeutic window, like anticoagulants, or affect key physiologic parameters, like agents for blood pressure or diabetes. Ask about adherence in a way that is open-ended and non-judgmental, that makes it okay for patients to admit their difficulties. For example, you could say, "Many patients don't take their medicines exactly as they should every day. In the last week, how many days have you missed a dose of one of your medicines?" To save time and still take an accurate medication history, use a medication list or the patient's pill bottles when they are available. If you have a list in the medical record that agrees with the patient's list or bottles, or if the patient seems reliable and can readily explain the differences, you can complete the medication history fairly quickly. A patient who can fluently describe the medication names, doses, frequencies, and indications, and is knowledgeable about recent medication changes, is likely a reliable source of information. It is not always necessary to get additional medication information from other sources. However, in a few situations, you may need to contact the patient's pharmacy or provider, or ask the family to bring in the medication bottles from home. This could be important if the patient is unsure about medication names, doses, and indications when asked to verify an existing list, or if the patient cannot explain discrepancies among medication lists. Gather additional data if the patient doesn't have a list and can't provide medication information reliably from memory. This is important if the available medication list has not been updated recently. The nature of the missing information should also be taken into account. For example, if the only unresolved piece of information is the dose of a cholesterol-lowering medication, then it is not as urgent to call the pharmacy for confirmation. But if the issue in question is the dose of insulin, where any dose is possible and the risk of over or under treatment are high, then it might be necessary to contact the pharmacy or outpatient provider's office. Here is a short video that demonstrates the process of taking an accurate medication history when a medication list is available.
Mrs. Davis, I'd like to go over your medications with you to make sure we have a correct list.
Can't you just look on my records? It should all be there.
Actually, I do have a printout of your medication list right here. Sometimes things change though, and we may have information that's out of date. This list is from a few months ago, so I'd like to go over it with you if that's okay.
Okay.
Could you tell me what medications you take, their strength, and when you take them? I'll check them off the list as I go.
Well, in the morning when I wake up, I take omeprazole, 20 milligrams. And then there's also sertraline, which is 100 milligrams. Then there's Synthroid and the blood pressure medication, but I'm blanking on the name.
Okay, I've got the omeprazole here and the sertraline. Your medication list says you're taking the sertraline at night.
Well, I did at first, but then I was having trouble sleeping, so my doctor told me to take it in the morning instead, and that helped out a lot.
Okay, good. About the Synthroid, what dose are you taking?
I don't know. It's 100 something.
Your list says 112 micrograms. Does that sound right?
Yes, that sounds right.
Has anyone changed the dose of that medication recently?
Oh no, I've been on that medicine for a couple of years.
Okay, now what's the name of that blood pressure medicine?
I really can't remember.
I have amlodipine on your list. Does that sound correct?
Yes, that's it.
5 milligrams?
Yes.
Okay, so we've confirmed your omeprazole, sertraline, Synthroid, and amlodipine. Is there anything else that you take?
Isn't that it?
Well, actually, I have a couple of other things on your list here. Do you take simvastatin? It's a medication for cholesterol.
No, but I used to. I was having muscle aches, and so my doctor switched me to something else, and it starts with a P.
Pravastatin?
Yes, that's it.
Do you know the milligram dose?
Yes, 20. It was the same as the simvastatin.
Okay, I also have trazodone on your list.
What's that?
It's a medication that some people take for depression or to help them sleep.
Okay, that must be the medicine that they gave me when I had trouble sleeping, but I don't take that anymore. Changing the sertraline to the morning did the trick.
Okay, I'll scratch the trazodone off your list. Do you take any other medicines?
Not that I can think of.
Has anyone prescribed anything new for you in the last few months?
No.
Do you take anything over the counter, such as herbs, vitamins, supplements?
Does cinnamon count?
Cinnamon does count. How much do you take?
I take 2 capsules a day.
Anything else?
No, that's it.
Great. We'll update your medication list, and I'll give you a copy to keep.
Here's another short video that demonstrates taking an accurate medication history when a medication list is not available.
Mrs. Jones, next I'd like to go over your medications. Do you have your list or pill bottles with you?
No, they're at home.
In that case, can you tell me what medications you take?
Sure, I take high blood pressure medicine, 2 of those, lisinopril and HTZ, and diabetes pills. And then the doctors put me on a blood thinner about 6 months ago when I had my heart attack. And then I take a cholesterol medicine at night. I think that's it.
Okay, let me ask you about those. You mentioned HTZ. Do you mean HCTZ? We also call that hydrochlorothiazide.
Yeah, that's it. I can't remember that long name.
Okay, well, how much of that do you take?
It's 12 something. It's half a 25.
Okay, well, how about the lisinopril? Do you know the strength of that one?
No, it's been a long time. I don't pay attention.
Would it be okay if I call your pharmacy to check on the dose?
Sure, I get it at RX Express on Highway 90.
Okay, I'll give them a call after we're done talking. You mentioned diabetes pills. How many different ones do you take?
Oh, there's just one.
Oh, well, what's that called?
That's metformin. I take it in the morning and in the evening.
Can you tell me how much you take at each time?
2 pills in the morning and 2 pills in the evening.
I don't suppose you know the strength, do you?
I think it's 500 milligrams.
Okay. The next thing you mentioned was a blood thinner. Can you tell me the name of that?
It starts with a C, but I can't think of the name of it.
Is it Coumadin?
I'm not sure.
Well, do you get your blood tested every few weeks to see how thin it is?
No, I don't do that.
Huh. Is the medicine clopidogrel?
Yeah, that's it.
Okay, well, that only comes in one dose, 75 milligrams. You mentioned a medicine for cholesterol. Which one is that?
It's something statin. My doctor just switched that one. She said my cholesterol wasn't under control and she wanted me to take a stronger one. It's one that just went generic.
Could it be atorvastatin?
Yes, that's it. I knew it started with an A. It's 10 milligrams.
Okay, so far here's what I've got. HCTZ, half a 25 milligram tablet. Lisinopril, I'll check the dose with your pharmacy. Metformin, 500 milligrams, 2 pills in the morning and 2 in the evening. Clopidogrel, 75 milligrams, and atorvastatin, 10 milligrams at night. Let me ask you to be sure, when during the day do you take the HCTZ, lisinopril, and clopidogrel?
I take all of those in the morning.
Do you have any other medications?
Not that I can think of, unless you count the antibiotic.
Sure, tell me about that one.
Well, they gave me Cipro for my bladder a couple days ago and told me to take it for 3 days. That's twice a day.
Okay, anything else?
No, I think that's it.
Let me run through a few other things just to be sure. I saw in the nurse's notes that you had asthma. Do you take anything for that?
Yeah, I have an inhaler. I use it a couple times a day. It's a steroid spray, but I can't think of the name of it. And I have albuterol, but I don't need to take that very often.
Do you take any other medicines from time to time, only when you feel like you need them?
Yeah, I take ibuprofen when my back hurts. And they gave me those little nitro tablets, but I don't need to take those.
How often have you needed to take the ibuprofen?
For the last week, 2 or 3 times a day.
And what's the strength?
400 milligrams, and I take a couple at a time.
Okay. Any other medicines that you take only when you need it? Like any medicines for headaches, allergies, or to help you fall asleep?
No.
Do you take any medicines that you can buy off the shelf without a prescription?
Well, I get my baby aspirin in a big bottle from the warehouse store.
Okay. Anything else you get from there?
Yeah, I get fish oil from there, and I take 1 gram a day.
Anything else? Any other nutritional supplements, vitamins, or herbals?
No, I think that's it.
So let me review again. We've got HCTZ, lisinopril, metformin, clopidogrel, and atorvastatin. You've got a steroid inhaler that you use twice a day, and albuterol only when you need it. You've been on Cipro for the last couple of days. You take ibuprofen as needed for back problems, and lately you've been taking 800 milligrams 2 or 3 times a day. You have nitroglycerin tablets, but fortunately don't need to take them. And you take fish oil every day. Does that cover it?
Yes, it's a lot, isn't it?
Yes, it is a lot. I know I'd have trouble keeping up with that many medicines. I'd probably miss doses here and there and forget to refill my medicines on time. Tell me, in the last week, how many days have you missed a dose of one of your medicines?
Several other techniques not shown in these videos can increase the accuracy of the medication history. You can call the patient's pharmacy or pharmacies, perform a brown bag review of the patient's medication bottles, or obtain information from family members. Pill identifiers, like the one available on drugs.com, can be helpful for patients who know the appearance but not the name of their medications, or who bring in their pills but have removed them from the bottles. Let's review some take-home points. Taking an accurate medication history is important for reducing medication errors and adverse drug events. Unfortunately, it's not easy, and it can take time. Refer to a medication list when you can, but be sure to review and verify it with the patient. By using open-ended questions and specific prompts, you can elicit a complete and accurate medication history.